Hello, friends. My name is Dr. Shaival Chandalia. I'm a consultant endocrinologist and diabetologist from Mumbai. I am attached to Jaslok and HN Reliance hospitals, and I am part of the Dr. Chandalia's Denmark group of clinics. Hello, friends. Today we are going to talk about a relatively new class of medications called SGLT2 inhibitors and some of the advantages as well as disadvantages of this group of medications. What are SGLT2 inhibitors? SGLT2 inhibitors are a group of oral anti-diabetic medications that have become increasingly popular now, at least in the last decade or 10 years. Examples of these medications are, at least their generic name, canagliflozin, dapagliflozin, and empagliflozin. Some of them are off patent and hence are readily available. How do they work? Now, they work by inhibiting a transporter called SGLT2 that transports or reabsorbs glucose filtered into the urine. This results in reduced reabsorption of glucose from the urine into the blood. So there is a loss of glucose in the urine and hence the blood glucose is reduced. Therefore, this group of medications works on the kidney, and in this way it is different from other group of anti-diabetic medications. So other groups of anti-diabetic medications, your conventional ones like metformin or sulfonylureas, work either on the pancreas or on the muscle and fat in the body. But this particular group of medications, the SGLT2 inhibitors, what are the short form of sodium glucose cotransporter 2 inhibitors, they work on the kidney. So it is an entirely new method or a new mechanism of treating type 2 diabetes. What are some of the advantages of SGLT2 inhibitors? So we know that they lower the blood glucose significantly. Also, there is loss of glucose, and glucose is a form of calories. So there is loss of calories in the urine, and hence there is a loss of weight. And glucose lowering in the blood occurs without hypoglycemia, that is, without a low sugar reaction. So they are effective and they are safe. They produce weight loss. And in long-term studies, this is probably the most important thing. In long-term studies, SGLT2 inhibitors protect the heart and the kidney. So therefore, these are a group of anti-diabetic medications which are not only controlling sugars without producing low sugar reactions, reducing weight, reducing blood pressure, but also protecting the heart and kidney and thereby reducing the risk of heart failure as well as kidney disease. Now, what are the disadvantages of SGLT2 inhibitors? Now, there are rare side effects. Remember that these side effects are not seen commonly, and they should not prevent you from starting or your doctor from starting SGLT2 inhibitors in the majority of patients. So what are the rare side effects? Due to loss of fluid and electrolytes along with the glucose in the urine, rarely the blood pressure can drop, leading to falls and fractures. So because glucose is lost in the urine, it pulls the water and sodium along with it, and sometimes blood pressure can drop, resulting in falls and fractures. But this is, of course, a rare situation. Also, your kidney test, the creatinine can increase marginally in the first few weeks of starting this medication. What is the creatinine? Creatinine is a kidney test obtained by a blood sample. It's a blood test for the kidney, and this kidney function can sometimes slightly reduce at the beginning of starting this medication, but later on it stabilizes. And also, very rarely, a diabetic ketoacidosis can be triggered. That is a serious condition involving an increase in acid level in the blood. So this is, of course, very rare, but you have to be aware of some of these side effects. What are the other disadvantages of SGLT2 inhibitors? Now, far more commonly than some of the rare side effects that I mentioned in the previous slide, there is an increase in genital, fungal, and urinary tract infections. By genital, I mean private parts and the skin around it. There can be a fungal infection as well as a urine infection in the bladder. So why does this happen? Due to loss of glucose in the urine, there is an increase in growth of bacteria and fungi on the private parts or in the urine of the patient, because glucose is like a medium, a nutrient medium for growing of various bugs, whether they are fungi or whether they are bacterial infections. So therefore, there can be a fungal infection of the skin and private parts or there can be a bacterial infection of the urine. Fungal infections occur over the private parts with itching or redness in that area. They are more common than lower urinary tract infections, which are bacterial infections of the bladder. These give rise to burning in the urine and fever. So you can have a genital fungal infection of the private parts, which leads to itching and redness, or you can have a bacterial urinary tract infection of the bladder, which can give rise to burning as well as fever. Both of these type of infections are usually mild and can be treated with antifungal creams and or oral antifungal or antibacterial antibiotics. So these are mild problems. They can be treated and they should not prevent you from using the SGLT2 inhibitors in the majority of patients. Of course, if somebody develops any of these infections, then you should stop the medication and treat it before you consider your next course of action. Now, how do you prevent these infections? If a patient has a history of recurrent urinary infections or prostatic enlargement in a male, it is better to avoid this group of medications. So, in the rare situation where somebody has recurrent urine infections in the past or has an enlarged prostate causing these infections, then you should avoid using this group of medications. Secondly, if you are giving this group of medications, patients should be instructed to drink plenty of water. Good genital hygiene should also be maintained. After passing urine, the private part should be wiped or washed with water. To summarize, these side effects are mild and easily managed, and the benefits of this group of medications far outweigh any risks. Friends, I will end this short deliberation on SGLT2 inhibitors by summarizing. Remember that this group of medications has long-term benefits in terms of protection of heart and kidney disease, and they should be given to the majority of patients in our private practice. If they have side effects like genital fungal or urinary tract infections, these can easily be treated. Thank you very much.